Have you ever walked into a room and completely forgotten why? Maybe you've struggled to remember a familiar name, lost your train of thought mid-sentence, or opened your medicine cabinet and wondered, could one of these pills be causing this? Most people assume memory loss is simply part of getting older. But what if, in some cases, it isn't? What if the very medication meant to help you sleep, calm your anxiety, ease your allergies, or control your bladder is quietly interfering with the way your brain forms memories? Here's what's even more surprising. Some of these medications have been prescribed safely for decades and remain the right choice for many people. But for older adults, especially those taking several medications together, the balance between benefit and risk can change. By the end of this video, you'll know which commonly used medications deserve a second look, why some are more concerning than others, and one hidden problem that many doctors and patients overlook until memory problems have already begun. Because protecting your brain isn't just about puzzles, vitamins, or eating blueberries. Sometimes it starts with what's already in your medicine cabinet. Welcome to Neural Hours. Here, we separate medical myths from scientific evidence so you can make informed decisions about your health. Today's video isn't about telling you to stop taking your medication. In fact, doing that on your own could be dangerous. Instead, this is about understanding how certain medications may affect the aging brain, why some people are more vulnerable than others, and how to have informed conversations with your doctor or pharmacist. Because knowledge, not fear, is what protects your health. Let's begin. Your brain is talking every second. Imagine standing in the middle of a crowded city. Millions of people are moving in every direction. Traffic lights coordinate every intersection. Messages travel instantly. Nothing crashes. Nothing collides. That city is your brain. Nearly 100 billion nerve cells communicate every second using tiny chemical messengers called neurotransmitters. One of the most important is acetylcholine. Think of acetylcholine as the brain's memory messenger. It helps nerve cells communicate. It allows you to learn new information. It helps you stay focused, and it plays a critical role in forming new memories. As we grow older, the amount of acetylcholine naturally declines. This is one reason learning new information often becomes more difficult with age. Now, imagine taking a medication that further reduces the activity of this already limited chemical. For some people, nothing noticeable happens. For others, especially older adults, memory becomes fuzzier. Thinking slows. Attention drifts. Confusion appears more easily. Not because the medication is poisoning the brain, but because it is changing the way brain cells communicate. That doesn't mean these medicines should never be used. Many are highly effective. Some are life-changing. The key is understanding who benefits, who is at higher risk, and when safer alternatives may exist. Because here's something many people never hear. Sometimes the greatest risk isn't a single medication. It's several medications working together. But before we uncover that hidden danger, we need to start with one of the most common medications found in homes around the world. A medication millions of people take without thinking twice. Spring arrives. Your nose runs. Your eyes itch. You stop by the pharmacy. Within minutes, you've picked up an allergy medication you've seen advertised for years. No prescription, no warning signs, just relief. One of the best-known examples is diphenhydramine, commonly sold under the brand name Benadryl. Many people also take it as a nighttime sleep aid because it causes drowsiness. For younger adults using it occasionally, that's usually not a major concern. But in older adults, the story becomes more complicated. Diphenhydramine belongs to a group of medications called anticholinergics. Remember acetylcholine, the brain's memory messenger? These medications partially block its activity. That action helps dry up a runny nose, but it can also affect brain function. Researchers have found that medications with strong anticholinergic effects are associated with short-term problems, such as increased confusion, slower reaction time, reduced attention, and temporary memory difficulties, particularly in older adults. That's one reason the American Geriatric Society Beers criteria, a widely used guide for medications that may be inappropriate in many older adults, recommends avoiding diphenhydramine whenever possible in people aged 65 and older. Instead, newer antihistamines such as loratadine or cetirizine often provide allergy relief with much less effect on the brain. That doesn't make Benadryl a bad drug. It simply means every medication has trade-offs. For someone experiencing a severe allergic reaction, Diphenhydramine can be an important medication, but taking it every night for sleep? That's a very different conversation, especially when safer options may exist. And here's the part that surprises many people. Benadryl isn't the only medication quietly blocking acetylcholine. There are dozens more. Some require prescriptions. Others sit openly on pharmacy shelves. And when several of them are taken together, their effects can add up. But before we get to that hidden stacking effect, there's another category of medication that's prescribed millions of times every year, and unlike allergy medicine, stopping it suddenly can be dangerous. Before we continue, I'm curious about something. How many prescription or over-the-counter medications do you take each day? 1, 3, 5 or more? Leave the number in the comments. Not because anyone is judging, but because your answer may help someone else realize they're not alone. And if you're finding this information useful, consider subscribing to Neural Hours. Every week we break down complex medical research into practical information you can actually use to protect your health and your brain. Next, we'll look at medications many people rely on for anxiety and sleep. They can be incredibly effective, but when used for months or years, especially in older adults, they may carry risks that aren't always discussed when the prescription is written. And one of the medications after that is still prescribed for pain, migraines, and insomnia. Even though many geriatric specialists now recommend looking for safer alternatives, when a good night's sleep comes at a hidden cost. It's 2:30 in the morning. You wake up, you stare at the ceiling, your mind won't slow down. You glance at the clock. Just one pill, you tell yourself. Within 30 minutes, you're asleep. For millions of people, this has become a nightly routine. Sleep medications and anti-anxiety drugs can be incredibly effective when used appropriately. They can relieve severe anxiety, stop panic attacks, and help people through periods of acute insomnia. The problem isn't that these medications exist. The problem is what can happen when they quietly become part of everyday life. One important group of medications is called benzodiazepines. These include drugs such as diazepam, Valium, lorazepam, Ativan, alprazolam, Xanax, and clonazepam, Klonopin. They work by increasing the activity of a calming brain chemical called GABA. Think of GABA as the brain's brake pedal. When it's activated, nerve activity slows down. Your muscles relax. Your anxiety eases. Your thoughts become quieter. That's exactly why these medications can be so effective. But here's where things become more complicated. As we age, our bodies break down medications more slowly. That means the same dose that worked safely years ago may remain in the bloodstream much longer later in life. Instead of simply helping someone fall asleep, the medication may still be active the next morning, or even the next afternoon. That lingering effect can lead to drowsiness, slower thinking, poor concentration, reduced balance, increased risk of falls, and in some older adults, memory problems. Research has consistently shown that long-term benzodiazepine use is associated with cognitive impairment, although scientists are still studying whether the drugs themselves directly contribute to dementia or whether the underlying conditions such as anxiety and insomnia also play a role. That distinction matters, because association does not automatically mean causation. But regardless of the cause, most geriatric specialists agree on one thing. These medications are generally best reserved for short-term use whenever possible, with regular review to determine whether they are still needed. And one warning cannot be repeated enough. Never stop benzodiazepines suddenly without medical supervision. Doing so can trigger withdrawal symptoms, severe anxiety, seizures, and other serious complications. If changes are needed, they should be gradual and guided by a healthcare professional, because protecting your brain should never come at the expense of your safety. But what if the medication isn't for sleep? What if it's for depression? Surprisingly, one antidepressant has drawn particular attention because of the way it affects the same memory chemical we discussed earlier. Depression itself can affect memory. So can anxiety. So can chronic stress. That's why treating mental health conditions is often one of the best things you can do for your brain. Most modern antidepressants have little or no anticholinergic activity. But there is one exception that doctors often think carefully about in older adults: paroxetine, sold under the brand name Paxil. Like other antidepressants in its class, paroxetine can be very effective for depression and anxiety. For many people it works well, but unlike several other commonly prescribed SSRIs, paroxetine also has stronger anticholinergic properties. Remember acetylcholine, the chemical messenger responsible for learning and memory. Blocking it may increase the likelihood of confusion, brain fog, and memory problems in some older adults. That's why paroxetine appears on the American Geriatric Society Beers criteria as a medication that may not be the best first choice for many adults over 65. Notice the wording, may not be the best first choice, not, never use it. For some patients, paroxetine may still be the right medication because every treatment decision involves balancing benefits and risks. But if someone develops increasing confusion or memory problems after starting a medication, it's worth discussing with their healthcare provider whether another option might provide the same benefit with fewer cognitive side effects. The lesson here isn't about one specific drug. It's about understanding that medications within the same family are not always identical. Small chemical differences can have very different effects on the aging brain. And that brings us to another medication that's been prescribed for decades, one that many people take for nerve pain, migraines, insomnia, or depression. Yet today, many specialists consider it one of the strongest examples of why older prescribing practices continue to evolve. The older medication that can slow the brain. Imagine buying a car in 1985. At the time, it was considered one of the best available. Reliable, popular, trusted. Fast forward 40 years, that same car still works. But today's models are safer, more efficient, and packed with improvements that simply didn't exist before. Medicine works the same way. Some older medications remain excellent choices. Others have gradually been replaced as newer options with fewer side effects became available. One example is amitriptyline. Originally developed as an antidepressant, it's now frequently prescribed for chronic nerve pain, migraine prevention, certain sleep problems, fibromyalgia, chronic pain syndromes. For many patients, it works remarkably well. But amitriptyline also has one of the strongest anticholinergic effects among commonly prescribed medications. For younger adults, that may simply cause dry mouth or constipation. For older adults, the brain may feel the effects much more strongly. Some people experience mental slowing, difficulty concentrating for, increased confusion, memory problems, daytime drowsiness. Again, not everyone. Age matters. Dose matters. Other medications matter. Overall, health matters. That's why many physicians now consider alternatives when appropriate for older adults who develop troublesome side effects. The goal isn't to eliminate effective medications. The goal is to find the treatment that provides the greatest benefit with the fewest unwanted effects. And after reviewing these individual medications, you might assume we've already covered the biggest risk. But we haven't, because the greatest danger often isn't one pill. It's what happens when several of these medications quietly begin working together. And once you understand that hidden accumulation, you'll never look at a medication list the same way again. Imagine this. An elderly woman begins seeing things that aren't there. She becomes agitated. She starts accusing family members of stealing from her. She wanders at night. She's frightened. Her family is exhausted. Eventually, her doctor prescribes an antipsychotic medication. For some families, this medication can be life-changing. It may reduce dangerous aggression, calm severe hallucinations, or help someone suffering from schizophrenia or bipolar disorder regain stability. These medications have an important place in medicine, but they're also among the medications doctors use most cautiously in older adults, especially those living with dementia. Why? Because in this group, research has shown an increased risk of serious complications, including stroke and even death with some antipsychotic medications. That's why these medicines carry prominent safety warnings for older adults with dementia-related psychosis. That doesn't mean they're bad. It means the decision to prescribe them is never taken lightly. Doctors weigh difficult questions. Is the person becoming violent? Are hallucinations causing severe distress? Is the patient at risk of harming themselves or someone else? Sometimes the benefits outweigh the risks. Sometimes they don't. Every situation is different. This is one of the clearest examples of a principle we've seen throughout this video. The question isn't, is this medication dangerous? The better question is this medication appropriate for this particular person at this particular time? Because medicine is rarely black and white. It's about balancing risk against benefit. And while antipsychotics receive a great deal of attention, there's another problem hiding quietly in millions of medicine cabinets. A problem that's far more common. One that doesn't involve one medication at all. It involves several. When one pill becomes five. Imagine trying to have a conversation in a crowded room. One person speaks. You hear them clearly. Then another begins talking. Then another. Soon, 5 different voices are competing for your attention. Eventually, you stop understanding any of them. Something similar can happen inside the aging brain. A person might take an allergy medication, a bladder medication, a sleep aid, a medication for nerve pain, perhaps another for dizziness. Each one, by itself, may have only a small effect on memory, barely noticeable. But together, those effects can begin to accumulate. Doctors call this anticholinergic burden. You've already learned about acetylcholine, the chemical messenger that helps the brain form memories. Now imagine several medications partially blocking that messenger at the same time. Each one adds another small weight. One weight isn't very heavy. 5 weights become much harder to carry. Over months or years, the brain has to work harder just to perform everyday tasks. The result may not feel dramatic. It may begin as subtle brain fog, difficulty concentrating, misplacing keys more often, forgetting appointments, searching for familiar words. Many people assume, I'm just getting older, but sometimes the medication list deserves just as much attention as the birthday candles. And here's something many people don't realize. This burden often develops without anyone noticing. Different specialists prescribe different medications. One doctor manages blood pressure, another treats allergies, another helps with sleep, another addresses bladder problems. Each prescription makes sense on its own, but no one steps back to look at the entire picture until memory begins to fade. Why medication reviews can be life-changing. Imagine your kitchen sink. 1 faucet dripping isn't a problem. 5 faucets dripping all day eventually overflow the sink. Medication burden works the same way. That's why one of the most valuable appointments an older adult can have isn't for a new prescription. It's for a medication review. A medication review means sitting down with your doctor or pharmacist and looking at everything you're taking. Not just prescriptions, over-the-counter medicines, sleep aids, cold medicines, allergy tablets, herbal supplements, even vitamins. Because sometimes the greatest risk isn't hidden in one prescription bottle. It's spread across 6 different products purchased over several years. Many pharmacists now use tools that estimate a person's anticholinergic burden. These tools don't automatically tell someone to stop taking medications. Instead, they help identify opportunities to ask important questions. Do I still need this medication? Could a lower dose work? Is there a newer option with fewer cognitive side effects? Could 2 medications be doing the same job? These conversations often lead to safer treatment plans. Sometimes nothing changes. Sometimes one medication changes everything. The important point is this: never stop a prescription medication on your own. Many medicines require gradual tapering. Others are protecting you from serious medical conditions. The goal isn't fewer medications at all costs. The goal is the right medications at the right dose for the right person. And that simple shift in thinking can make an enormous difference. Could memory loss actually be reversible? Here's one of the most hopeful discoveries in modern geriatric medicine. Not every episode of memory loss is dementia. Not every episode of confusion is Alzheimer's disease. Sometimes, the brain is responding to something that can be changed. An untreated infection, poor sleep, vitamin deficiencies, thyroid disorders, dehydration, or medications. When medication side effects are identified early and addressed appropriately, some people experience meaningful improvement in thinking and memory after adjusting their treatment plan under medical supervision. The amount of improvement varies from person to person. Some recover quickly, others improve gradually, and in some cases, memory problems are caused by an underlying neurodegenerative disease that continues despite medication changes. That's exactly why professional evaluation matters. The sooner reversible causes are identified, the better the chances of protecting brain function. But after everything we've discussed, there's one final lesson that ties this entire documentary together. It's not about one drug or one diagnosis. It's about becoming an active participant in your own healthcare. And that lesson could be the most important one of all. The 5 questions that could protect your brain. Imagine leaving your doctor's office with a new prescription. Most people ask one question: how often should I take it? But very few ask the questions that may matter just as much. If you're over 60 or caring for someone who is, These 5 questions can help you have a more informed conversation with your healthcare provider. Question 1. Is this medication still necessary? This may sound simple, but medications often stay on a person's list long after the original problem has resolved. A sleeping pill started after surgery. An acid-reducing medication prescribed during a hospital stay. An allergy medicine that became a nightly habit. Sometimes the medication remains simply because no one revisited it. That doesn't mean you should stop it. It means it's worth asking whether it's still serving its original purpose. Question 2. Is there a safer alternative for someone my age? Medicine changes. New research emerges. Newer medications often have fewer side effects than older ones. A drug that was considered an excellent choice 20 years ago may no longer be the preferred option for many older adults. Your doctor may recommend staying exactly where you are, or they may know of an alternative that better fits your current health. Either outcome is valuable. Question 3. Could this medication affect my memory or increase my risk of falling? Memory and balance are closely connected. Many medications that slow the brain also increase the chance of falls. And in older adults, a single fall can lead to fractures, hospitalization, or loss of independence. Sometimes avoiding a fall is just as important as treating the condition itself. Question 4. Are any of my medications interacting with each other? This question becomes increasingly important as medication lists grow longer. One medication may be perfectly safe, 2 may still be appropriate, but 6 or 7 together can create effects that none of them would cause alone. Interactions don't always happen because drugs directly react with each other. Sometimes they simply produce similar side effects that add up over time. That's why reviewing your entire medication list, not just the newest prescription, is so important. Question 5. Can we review everything I'm taking, including over-the-counter medicines and supplements? Many people forget to mention sleep aids, cold medicines, herbal remedies, pain relievers, allergy tablets. Yet these products can contribute just as much to medication burden as prescription drugs. Your pharmacist or physician needs the complete picture. Because they can't identify hidden risks they don't know exist. These 5 questions don't challenge your doctor's expertise. They strengthen the partnership. And when patients become informed participants in their care, everyone benefits. But there's one final misconception we need to clear up before we finish. Don't let fear make the decision. After watching a video like this, it's easy to become nervous. You might even feel tempted to open your medicine cabinet and throw everything away. Please don't. The purpose of this documentary was never to create fear. It was to create awareness. Every medication we've discussed today has helped millions of people. Benzodiazepines have stopped severe panic attacks. Antidepressants have saved lives. Antihistamines have treated dangerous allergic reactions. Antipsychotics have protected patients experiencing severe psychiatric illness. Even medications with strong anticholinergic effects may still be the best option for certain individuals. The question has never been, is this medicine dangerous? The real question is this the right medicine for me at this stage of my life? And is it being reviewed regularly? That's a completely different conversation. Medicine is about balance. Every treatment involves weighing potential benefits against possible risks, and those risks change as we age. What was appropriate at 35 may deserve another look at 75. That's not because medicine failed. It's because your body has changed. Your brain has changed. Your kidneys process drugs differently. Your liver works differently. Your brain becomes more sensitive. Good healthcare adapts to those changes, and so should we. The most powerful tool you have isn't a pill. We've spent this entire video talking about medications, but here's something remarkable. The most powerful tool for protecting your brain isn't found inside a prescription bottle. It's knowledge. Knowing what you're taking, knowing why you're taking it, knowing when to ask questions, and knowing that memory loss isn't always an unavoidable part of aging. Sometimes it's your brain asking for help. Think back to the beginning of this video. You walked into a room and forgot why. You misplaced your keys. You couldn't remember a familiar name. Those moments don't automatically mean dementia, but they do deserve attention if they're becoming more frequent, more severe, or interfering with daily life. Don't ignore them. Don't panic either. Talk to your healthcare provider. Review your medications. Ask questions. Because when it comes to protecting your brain, the earlier you act, the more options you may have. Final takeaway. Today we've learned something that surprises many people. Memory loss isn't always caused by Alzheimer's disease. It isn't always caused by aging, and it isn't always permanent. Sometimes, the explanation is hiding in plain sight. Inside a prescription bottle, inside an over-the-counter sleep aid, inside an allergy medicine you've taken for years without a second thought. The goal isn't to fear medication, it's to use medication wisely, to understand that the right medicine at the wrong dose, or the right medicines in the wrong combination, can sometimes affect the brain in ways we don't immediately recognize. That's why regular medication reviews become increasingly important as we get older. Not because every medication is dangerous, but because your brain deserves the same attention as your heart, your blood pressure, and every other part of your body. If this video helped you understand something you didn't know before, let us know in the comments. Have you ever discovered that a medication was causing a side effect you weren't expecting? Or if you're comfortable sharing, how many medications do you currently take each day? Your experience might encourage someone else to ask an important question at their next doctor's appointment. And if you enjoy evidence-based documentaries that cut through myths and explain the science behind aging, brain health, sleep, nutrition, and disease prevention, subscribe to Neural Hours. Every week, we explore the hidden science that shapes your health so you can make better decisions long before problems become emergencies. Your memory is more than a record of your past. It's the foundation of every conversation, every relationship, and every moment that makes you who you are. Protect it not with fear, but with knowledge. Thank you for watching Neural Hours. Until next time, stay curious, stay informed, and take care of the only brain you'll ever have.